today with Tessa Shifflett, and I am so glad that I met you through Instagram and I get to kind of talk to you in person about your experience and everything. So, do you want to just start off by like introducing yourself, why you chose PT, and kind of your process through that?
Yeah, so I'm Tessa Shifflett. I currently work in Baltimore. I went to University of Maryland, Baltimore for grad school. I'm from California originally, though. The kind of reason I got into PT, I think, is very similar to a reason a lot of people got into PT. They got injured, and they went to PT at some point. So when I was a teenager and younger, I would dislocate my shoulder a lot, like chronic dislocations, like over 100. And I ended up having a total of three shoulder surgeries to help with that. And my surgeon was a good family friend, but surgeons can never guarantee anything, and they can't. So he always said, "Oh, you probably won't be able to swim again. You probably won't be able to do that." And that's like a really hard thing for a young kid to hear at 16. But my PT was always the one who had said, "No, you can. That's no, go ahead. We can do that." So I just, ever since then, I loved the idea of being the yes doctor, being the doctor that wasn't saying, no, you can't do that. It was being the doctor that encouraged people to do things rather than said, oh, let's not do that. Let's not do that. And kind of being the doctor that said, no, let's find the way to do that. So that's kind of that in combination with, I took a sports medicine class at my high school, and I had never really cared about school and I never really liked it, but I found that interesting, and anatomy was interesting. And it just kind of blossomed from there into going to PT.
That is so great. I love hearing about that too because I feel like that's such a big deal in today's world. Like a lot of doctors are saying like, oh no, you can't do that, you can't do that. And that, like you said, that's
Yeah.
hard for an athlete to hear. That's hard for even like an older person to hear, like they might not be able to walk, whether it's like with their grandchildren, whatever, enjoy their sports. So I love being the yes doctor. That's so exciting.
Yeah,
And
that's what I call myself. I'm the yes doctor.
I love that. I might steal that. So when did you graduate?
I graduated in 2022, so I'm only like a year and almost 2 years in
That's awesome. And what's
to
your
being like a
clinic
real
like that
PT.
you're working at?
I don't know how, if it's just Maryland specific, but in Maryland we have hospital-based outpatient clinics. So it's an outpatient orthopedic clinic inside of a hospital. And so we are a Medicare regulated facility, meaning we have to be up to a different Medicare code than a lot of other outpatient clinics do, meaning our billing is very specific, our billing is very different. So it has its pits and peaks. One of the perks is that we get complete one-on-one care for an hour. I don't ever, I mean, every now and again, I can double a patient if I need to, but it's one-on-one care. I see 7 patients a day, every hour on the hour. That's a patient. So it's nice from a clinician standpoint because I have friends who are in other outpatient clinics who see 17 patients a day, and that's like wild to me. So starting off my career here, I'm very spoiled. But the kind of pitfall for that is we are very expensive. Um, we bill insurance companies a lot of money to come see us, partially because we are in that hospital. We charge a gross facility fee, but that's kind of just wrapped up into our billing and charges. So we see, I mean, the good part about that is a lot of insurances cover it all. So it sucks for people who have like a high deductible. So people who are younger, healthier, fitter, they have a high deductible if they have kind of different plans that aren't necessarily Medicare, Medicaid, or a good healthcare worker, just things like that. If their deductible is really high, we're not probably a good choice because we're very expensive and we will take that $5,000 deductible pretty quick. But again, I don't deal with any billing or anything like that. That's something I make aware to my patients because we have to. But we see there are a lot of hospital-based outpatient clinics in the state of Maryland because of these Medicare regulation rules. But ours is a little bit different. We're part of the Advanced Orthopedic Institute at Sinai Hospital. And so, as well as, so that's kind of half of our surgeons. And then the other half is the International Center for Limb Lengthening. So it's another half. And then we also have our infectious disease specialist through the ICLL. And so because we're an inner city community hospital in Baltimore, we just have very advanced surgeons. We have advanced limb lengthening, advanced procedures, we see a very complex demographic. You know, if your mom rolls her ankle, I'm rarely the person that's going to see them. They're probably going to go somewhere else. We are the kind of people who see patients who we do a lot of joint replacements, and joint replacements are our bread and butter. And, but there are joint replacements for people that a lot of other surgeons wouldn't even touch. They have so many comorbidities. They have a really high likelihood for arthrofibrosis. They have just a poor health literacy level. They come from a poor socioeconomic status, and there are just a lot of reasons they probably shouldn't go under a knife. But our surgeons do, and our surgeons give them that relief. And I know a lot of PTs are very anti-surgery and do PT first and blah, blah, blah. And I think that's great. I really do. But I also can understand the benefit of, even though these people are sick, they still need help. And a total knee replacement is still the best thing for pain for an arthritic knee. So our surgeons kind of, I'm biased because I love our surgeons, but I think they're at just a different level because they're able to still get great outcomes. So I tend to see patients for a lot longer durations of caseload, for a lot more intensive care. So we do a lot of specializations in that, and that's just the joint replacement part of it. We also have the limb lengthening component of it, where people come for cosmetic limb lengthening, but they also come for it's something called congenital femoral dysplasia. So if kids are born with one leg shorter than the other, they go through about 3 lengthenings throughout their lifetime. So we just see, and from all over the world, people come to see us. So we have a pretty intense caseload. And one of our surgeons, Dr. Conway, she is one of the world's leading infection specialists. People come across the world to see her for infections. So it sounds crazy to say, but we are rarely people's first clinic, but we are typically their last clinic. The kind of patients we see have failed other places. The patients we have seen, I've seen a woman who had gone through almost 8 knee revisions, and the next option was she was going to lose her leg. And I saw her for 10 months, and, you know, it's a whole surgical approach. So it's an elevated different level of care that I just didn't think was typical. On top of that, we have a pretty substantial running program. A part of our clinic, we have a full 3D gait analysis research grade lab. We do a lot of research, not just our department, but the surgeons do a lot of research. My boss, he does a lot of research, but we have that to our disposal. So I can do squat analysis in a 3D lab really quickly. I just go put them in there, do it, run the metrics, and I have exact joint angles and torques for every single part of their body. And I can rearrange our care that way. We could do gait assessments that way. We do running assessments that way. We have an underwater treadmill. Like, we just have so much more tech at our disposal. So it's really not a typical outpatient clinic whatsoever. It's definitely higher level stuff than I ever thought. I do a lot of things that I didn't realize PTs do.
That is amazing. I'm a little bit jealous right now because that is really cool that you guys are doing such advanced things. Like, what is, I know you're not a surgeon, obviously, but what is a
Yeah.
limb lengthening? Like, what do they do for that?
So a limb lengthening is, there are a couple ways you can do it. It depends on the age of the kid. It depends, or the person. It depends on the bone that they're lengthening, because you can lengthen your femurs, your tibias, or in your humeruses. I've never actually seen like a forearm lengthening. To be honest, I've only ever seen a few humeral lengthenings. But what they do is the more common method now, if the bone is big enough, is they do an osteotomy. So they make a cut into the bone and they insert a rod, which then grows. And you lengthen the rod through a magnet, essentially. And that lengthens the bone. And so you need a lot of physical therapy to kind of maintain the length of your muscles and to help your muscles, nerves, vascular system stretch, everything grow along with it. So they can either do it that way, or they can do it with an external fixator where you're actually turning and the bones are growing that way. But more commonly, we really only see the fixators if there's like a rotation deficit, or if the bones are just too small or complicated, but it's typically internal lengthenings.
Wow, that is so cool. So I imagine pain modulation is a thing. Is that kind of done through medications? Is that a big part of your job?
So interestingly enough, because I think that too, and I actually ask patients all the time, like, are you sure this doesn't hurt? It doesn't really hurt. Weirdly enough, it's very sore. If they maintain the good extensibility of their joints, so if they're consistent with their therapy and their stretching and their home programs, then it's actually not that painful, to be honest. And I still can't believe that external fixators aren't painful. Like they just look painful to somebody who's never had one. Um, so the pain modulation is a part of it. We play a bigger role. Again, I think I mentioned to you that we have very good communication with our surgeons, and I just don't think that's something a lot of clinics have. If I have an issue with a patient, I can call the surgeon or the PA immediately, and they're down there in my clinic in 10 minutes, which is great. So a bigger risk is there are a lot of neural complications, nerve complications. So we play a bigger role in kind of identifying that, because the surgeons might see them every 2 weeks for clinic, but I'm seeing them every day for an hour. So I can pick up on a DVT, on a nerve injury much quicker, and I can alert the surgeon, and then we can get medications and they can do whatever. So we do play a big role in the care team, just in the sense of we're the ones with boots on the ground daily. And, if a knee is all of a sudden feeling different, that's a knee I have felt 5 hours a week for 3 months. So the surgeon's going to believe me when I say that's different. So we can just kind of pick up on those things a lot easier.
That is really cool. And then, so do you usually see your patients like 5 days a week or?
For the limb lengthenings, yeah, typically 3 to 5 days a week. It depends how many bones they're lengthening, how long they're going for. 3 to 5 times a week for those patients. Knee replacements are probably 3 times a week, 2 to 3. It just kind of depends on what's going on. But the lengthenings need typically 3 to 5 times a week.
Gotcha. That is so neat. Okay. And then you were also talking about braces are made at your clinic, and your boss actually kind of created this program. So tell me a little bit more
Yes.
about that.
So we make custom knee, elbow, and ankle braces to help with joint contractures. So arthrofibrosis and stiffness of the joint, stiffness of the muscle, stiffness of that. A lot of people, we make actually like dynamic braces that stretch the joint, stretch the muscle, stretch the capsule, that can quote unquote fix contractures. And we use it for contracture management. So what we kind of, if you think about the way we like to describe it, is it's like braces for your teeth, right? It's a low load, long duration force. So if you have a knee that's stuck at negative 10 degrees or negative 15 degrees and you want to get it to zero and stay at zero, you can be in the clinic and a therapist can apply, say, 50 pounds of force for 2 minutes total. Okay, that's what, 2 minutes? 400 pounds of force for that time. Like it's not a lot, but it's good. It's not that we shouldn't do that. But our braces can apply, say, 10 pounds of force to that knee. But if you wear them for 2 hours a day, that's 6,000, 2,000. It exponentially increases the amount of force that's going across that joint. And so what it does is it keeps that low load, long duration. And there are other companies, like the other companies like Jazz Brace, that do manage contraction management, and those are great options for certain things. Those are a static brace that you have to turn and turn. Ours, we use a Theraband system, which are dynamic braces, meaning that as the muscle tissue and as the tissue of the musculotendinous junction is changing, the brace is changing as well. So it continually, as you get a little more of that growth, it's pulling more and more into the growth. They're typically more comfortable because we're doing a custom cast to your leg. So just like you would get like a cast on your arm, we do a custom cast on your leg. So it like fits literally only you and only you, and it won't go to your other side. It doesn't do that. And as well as using the Theraband, if you're doing that stretch, say you have the brace on for 45 minutes and you're like, oh my God, my knee is so sore, I need to take a break. It's Theraband. You can just bend and your knee will bend and you can take that little break. So it's typically a little bit of a more comfortable management system for contractures.
That is so cool. And I even saw on your Instagram, like you make these in your clinic. So
Yeah, so we make them. Yeah, it's the therapist makes them. We have a couple of us who know how to make them, and I'm one of them. So we custom make them. Yeah.
that is great. Did you have to get any kind of additional certifications, licensing, anything like that to work in a setting like this?
No, nothing like that. And I think I didn't even realize what I was really signing myself into when I first started this job. To be honest, I think I was really over my head. Um, but I have taken. My boss has done a couple of weekend courses on how to make the braces. So I've learned through the one who made them and invented them. So that's been very cool.
That is amazing. That is so exciting too.
Yeah.
You're part of such a big system that does these such unique things. I think that's really great, especially as your first job out of PT school. That's awesome.
Yeah. I often say, like, and the reason I picked working here was because my boss who in question, he had said, like, during my interview, he had said, excellence is our baseline. If you don't want to be excellent, don't be here. Which makes sense. And a lot of my people in my class and a lot of my friends and people in the field are really like, I just want to get in, do my work, get out. I don't really care. And that's just never really been how I am. That's a fine way to be. That's just, I always knew like I left school feeling like I didn't know anything. And I wanted to be in an environment that really fostered help and learning and development. So it's definitely tough sometimes because I do feel like I'm always the dumbest person in the room. But I have to remind myself that like that's why I chose to be here was because I am the dumbest person in the room, and like that's what's making me better, and that's what's shifting me into a better person and therapist.
Absolutely. Yeah, you're going to be like one of the advanced people in these days. Like that is.
Eventually, one day.
And then you kind of just went through a unique experience, and I was just wondering if you could kind of explain what it was like going through this ovarian torsion that you experienced. We kind of learned
Yeah.
about testicular torsion. It is a medical emergency. So kind of talk about, if you don't mind, what were you experiencing? What kind of brought this on? What was your experience like?
So it was really random and happened very suddenly. I was laying on the couch and I had gotten up to go to bed. It was a Saturday night and it was like 11:30 and I felt a very specific pulling pain kind of centrally from my pelvic floor. And I thought, God, that hurts. Whatever. I took an Advil and I went to bed. I woke up the next morning at like 6:30 to go to the bathroom. When I was trying to go to the bathroom, I like just couldn't even move and I was in so much pain and I like fell on the bathroom floor and it was about 6:30 and I thought, okay, I'll let my husband sleep in and whenever he wakes up, he can take me to urgent care. Because it wasn't, we're trained in the medical field that it's not bleeding, my heart rate's fine, no chest pain, it's not a medical emergency. So I'm thinking like, I'm clearly fine. Like I'm not having a fever. It's fine. I'm not going to die. Like I'm fine. So I just kind of just kept laying down until he woke up and I said, you have to take me to urgent care. Like this is a different pain. This is horrible. This is weird. So we went to urgent care. And again, I think this is a place where being in the medical field, I have very high health literacy level. And I kind of was pretty clear with the doctor at urgent care. It's like, I've had IBS for years now. I have been constipated. This is not constipation pain. I have had a UTI. This is not a UTI pain. So do not tell me it's either of those. Keep looking because it's not one of those. I might, yes, have both, but this pain is not that. Like there's also something else. So they tested for all the regular things. And he had told me at urgent care, he was like, something's going on. And I don't think it's emergent. So you don't have to go to the emergency room, but definitely go get an urgent ultrasound tomorrow morning. So I called out from work. So this was Sunday now. I called out from work. I texted my boss. I said, hey, I have to get this urgent procedure. I'm not going to be in tomorrow. I'll let you know. Like, I don't really know. And the doctor at urgent care had A, given me pain medicines, and then B, also told me if it gets worse, go to the emergency room. So all Sunday, I kind of laid in bed. It didn't get worse. It actually got better because the pain medicines worked. So I actually felt a lot better come Monday. And then, so I didn't go to the emergency room. Monday, I went to get the ultrasound, and I've had abdominal ultrasound several times, both transvaginal and on top of the uterus. And they usually take 15-20 minutes. And then, but this one was taking like an hour, and the poor tech looked like she was going to cry. Like she looked so scared. So they didn't really tell me anything there. And all they told me was, you know, call your doctor in an hour. And I was like, well, like, should I just go to the emergency room? And they were like, well, we can't tell you that. You need to call your doctor in an hour. And I was like, well, what doctor? Because urgent care sent me here, but I have a primary care, or do I call my OBGYN? And they literally said to me, call whoever picks up the phone first, which is terrifying. So at that point, I was more scared than in pain. I really was not in a lot of pain because they'd given me pain medicine. So I went home and I called my doctor in an hour, and then they read the report, and my doctor had said, go to the ER. I went to the ER and they did a million tests, and they said, It could be ovarian torsion, but it's hard to, we can't really tell unless we get in there. So they did an emergency surgery. It was a little bit rotated, but it was more of like a spasm of the ovary rather than what we think. It's hard to tell. It wasn't like severely rotated, but that was that. And they thought it was going to be a 6-week recovery. It ended up being a 2-week recovery. And here I am.
And that's amazing too. And I think that speaks levels about you as a therapist, but also as because you even are practicing what you preach. You know, you work out, and we
Yes.
do talk about like even doing prehab before surgery because then you have such a better outcome. So I think that really helped you in the long run.
Yeah, I agree. I agree. And I literally day 2, I was already doing my like pelvic floor exercises and transverse abdominis, like engagement and pelvic tilts and walks, like going on as many walks as I could. And so it does help to practice what you preach, I will say.
Absolutely. Yeah, I was watching your videos and you were like in the gym already. You were doing what you could.
Yep, day
That was awesome.
4. Got to do it. Yeah, just have to like modulate what you can do for your body. And that's what I tell all my patients. You just meet your body where your body is that day and do
Exactly.
the best that you can do that day for your body.
Absolutely. And then you're
Yeah.
also writing a book. What's your book about? What's that process been like?
Yeah, I'm writing one book for now. I have proposals for 4 other ones afterwards. It's basically about preventative healthcare and the socioeconomics, the ethical considerations behind preventative care, but it's all told in the scope of through patient stories. So I go through different patients who I've had in my life and different why I am with them, and it goes through the care they received and the care they didn't receive. And it talks about why they got the diseases they did. And I really break down in pretty layman's terms, this is what the disease is. This is how we treat it. This is exactly how much it costs for us to treat it. This is exactly how we could have prevented it. And this is how much it costs to prevent it. And it's astounding. I mean, the cost of, for one of the chapters alone, there was almost like a $3 million difference over a lifetime for one patient preventing versus treating one disease, which is wild. And then I take into the ethical parts of it of, as providers, we take the Hippocratic oath to do no harm, but where is it our ethical consideration to, if we know we can prevent harm, why aren't we? And why are the limitations of that? Because we all know it. Nothing in this book is novel in the sense of I didn't come up with this idea of we should prevent disease. Like that's not life changing, but it kind of explores why we don't and the healthcare limitations behind that. Because nobody gets into the medical field thinking, yeah, I'll just be fine. I'll just be average. Like I'll do what I do and then I'll go. Everybody goes into the medical field because they want to help people. Um, so then why aren't we? And it kind of talks about the limitations from not only the patient side, but the care provider side and the limitations that I know my physicians go through billing wise.
You are incredible. I hope you realize that. That's so exciting. Like that
Yeah.
fine. What is your book called? When's it gonna be released?
It's called Not Just the Medicine, but the Vitamin, and we're hoping to release in the fall of 2025,
Very cool.
hopefully.
What's it been like meeting with publishers?
Scary and very over my head. I'm not a writer by trade. I'm barely a physical therapist by trade, to be honest. So it's been like very in over my head. I just kind of go in with the approach. It's kind of the same thing I do as being a therapist of I really understand my limitations. And I've always kind of described it as like my thoughts are too big for my brain sometimes. And I just need to get all of my thoughts out and then find the people who can help me put those thoughts into a reality. So that's kind of how I go through life. So I'm really aware that as I meet with publishers and, like rip it apart, like give it to like really do that because I'm not a writer and I want it to be the best version it can be. So if we think that's tearing it down and building it back up, awesome. Let's do that. Like going in just really humbly, but like just aware. And I think that was something I got from school. One of my professors had said, like, go into every interaction you have with absolutely everybody, thinking that you have something to learn from them. So with patients, with providers, with editors, with publishers, with agents, with everything, like I just kind of approach every situation as like, I'm here to learn from you. So help me.
That is amazing. Oh my goodness. I'm excited for you, and I think that
Thank
is
you.
such a niche role for you. I feel like you've really found kind of your calling and your place, and I'm excited for
Yeah.
you because even I feel like you were
Thank you.
definitely made to be where you're at, and that's just opened this amazing door, and you're gonna change lives and change minds.
Oh, I hope so. I hope so. That's all it's about, is just helping people.
Definitely. Well, thank you so much for your time, and I'm definitely gonna
Yeah,
link
absolutely.
your information just so that people can kind of follow your journey. So that's exciting.
Perfect. Thank you.
Absolutely, and enjoy the rest of your day.
Thanks, you too.
Thanks.